The mother-in-law is worried, disturbed, that what should have brought joy to the family, happiness, and thanksgiving eventually suddenly becomes an issue since the mother of the baby is unwilling to see the baby again. What could have happened? Why Teniola, who just gave birth to a bouncing baby boy, suddenly became irrational, unwilling to breastfeed the baby, unwilling to even carry the baby, sometimes intending to harm her newborn baby. This experience was debilitating, was challenging to the family. The husband became unhappy, troubled, living in fear because he has never experienced such before. This was the story of Teniola, a 36-year-old woman who, despite long delay, who gave birth to her first son after 9 months of pregnancy, only to come down with what is technically called postpartum depression. Postpartum depression is a mood disorder that usually comes after childbirth, characterized by feeling of hopelessness and loss of interest in pleasurable activities. The mother of the baby most of the time find it difficult to sleep and most of the time unwilling to breastfeed the baby and sometimes would not want to see the baby at all. It is a very challenging situation for some women who come down with this condition. It is a mental health issue that is commonly found in women after childbirth. And sometimes it is characterized by aggression and irritability towards the baby and to people around her. Because most of the time, there is always mood swing in this individual, I mean the mother, and based on this, she behaves irrationally to herself and to people around her. There is always a constant experience of weeping spell, crying for no reason, and sometimes experiencing guilt feeling. Postpartum depression is very common in women, but one of the most challenging situations about this condition is that so many people are not aware that postpartum depression exists. Research has shown times without number for those individuals who are not aware or the family members are not knowledgeable about this mental health condition, a lot of troubles and a lot of heartaches are usually experienced because they do not even know where to get the solution to the challenge. But I am here today to shed more light to this condition because it is something that happens occasionally or happens sometimes to some individuals. So in this content, we are going to share not only the symptoms, we are going to share some of the risk factors, things that usually trigger postpartum depression among women. And not only that, we are going to talk about what are the way out solutions that people can adopt in order to prevent postpartum depression. Now, if it happens, what are the way out? What are the steps that the mother, the family, the husband can take or could take to ensure that this situation is brought under control? Follow us as we go along in this presentation. Don't forget, as you get value for our presentation, do like, share, subscribe to Francis Mental Health Solution TV, because here your mental wellness is our priority. Now we want to quickly look into what are the risk factors. In other words, what are the things that usually trigger the onset of postpartum depression? Let us not forget that we have said this is a mood disorder that usually happens after childbirth and usually is more common in women, although few men sometimes experience, but majorly it is a condition that is found in women. Now, one of the risk factors of postpartum depression, which I withdraw from many years of clinical practice, is prolonged labor. You know, we are in a culture whereby people believe that when women want to give birth, if they are not able to do it naturally, it is as if they have sinned against God. It is as if they have committed a taboo. And so because of that, there are so many women in the course of delivery, labor and delivery. The first day they are in labor, second day they are still in labor, third day they are still in labor, fourth day, some individuals beyond 4 or 5 days, they are still pushing for the baby to come out. This kind of approach and method is counterproductive, and it puts the life of the baby as well as the mother at risk. Beside the fact that the baby could die, beside the fact that the baby could lack oxygen and develop complications, beside the fact that the life of the mother could be jeopardized, the mother, the individual who carries the baby, could also come down with postpartum depression, which is depression following after childbirth. And so a lot of individuals come down with postpartum depression these days following prolonged labor, a labor that has gone beyond the normal period. And so because of that, because of a lot of changes that have happened to the individual during the period of labor, some individuals come down with postpartum depression. Another very important factor that has also been implicated in making people to come down with postpartum depression is history of mental illness in the family of the mother. In other words, the mother carrying the baby, if there is a positive history of mental illness in her family, whether it's depression, whether it's anxiety, whether it's that of schizophrenia, or any of the mental health challenges, the individual is already at risk. This individual could come down with postpartum depression. So if the mother of the child to be, or the mother carrying the baby, come from a family where there is positive history of psychiatric illness in the family, this can trigger the individual coming down with postpartum depression. What other factor do we have to also identify or look into in talking about postpartum depression is the history of mental health challenge in the mother prior to pregnancy. There are some individuals during adolescence, they have suffered depression or anxiety or post-traumatic stress disorder. They were treated, they got well, they were using their medication. Even the man who came to marry them never knew that they have had that history in the past, because they show for face, it doesn't show in the face. And the woman herself, she's not ready to disclose, she's not ready to tell her past history in this dimension to the man. Consequently, individual with past history of psychiatric illness, whether treated, managed, and the individual is now functioning well, could come down with postpartum depression, which is associated with depression. So it is important for us to emphasize this, because many individuals have had a history of mental health challenges in the past. They are normal, they are doing well, they are doing fine, they are going to marry, but they have left their medication without using it. And these can subsequently lead to postpartum depression, which is what we are discussing today. Importantly, it's important for me to talk about undue stress during pregnancy. Anything could be the stressor. Undue stress during pregnancy will make an individual to come down with postpartum depression. And I said initially about prolonged labor. Prolonged labor is characterized by undue stress for an individual. And also in things that can be shocking, things that are very traumatic during pregnancy can make an individual to come down postpartum depression. So undue stress, prolonged labor, past history of mental illness in the mother, as well as positive history of mental illness in the family of that individual, are risk factors among many other things that can make an individual to come down with postpartum depression. Now, how do we prevent individual coming down with postpartum depression? How do we help mothers who are carrying pregnancy from coming down with postpartum depression? How do we help prospective couples to ensure that their wives to be, when the individual is pregnant, will not come down with postpartum depression? One very important thing is to cancel the rule that at all costs, whether the baby is big, whether the pathway through which the baby is coming out is also very narrow, it must be through natural birth. To prevent postpartum depression, we must rule out, ensure that woman does not go through prolonged labor. The issue of prolonged labor must be addressed in our culture. It is risky to the mother, it's risky to the mental health of the baby, it's also risky to the mental health of the child as well as the mother. It also puts the family at risk, including the husband. So ensuring that there is no prolonged labor in the course of delivery is one way of preventing postpartum depression. Very importantly, individuals who have past history of psychiatric condition or mental health illness should ensure that while they are in pregnancy, they are still using their medication. They are still going through their treatment. They don't abandon their treatment. They don't abandon their therapy. This will go a long way in preventing postpartum depression. Very importantly, individuals who are getting married should ensure that they do what I technically call mental fitness evaluation test. These evaluation tests will help the individual couples to understand the past history of each other. In other words, if there is any positive history of any mental health issue in each of the family, especially from the wife, it's not automatically saying that they are going to cancel the marriage. That does not mean that the marriage will not continue, but that will position the two of them to work on each other to ensure that things that needs to be corrected are corrected, because a positive history of mental health in the family, if it is associated with stressful life events for the mother, can make the woman to come down with postpartum depression. So putting all these measures into consideration will go a long way in preventing an individual, the mother, from coming down with postpartum depression. Now, what are the way forward? When an individual comes down with postpartum depression, what should be done immediately? The baby should be taken away from the mother. Because at this point in time, the mother does not believe that she is the mother of the baby. The mother is traumatized. The mother is having mood swing. The mother is irritable. The woman can drop the baby on the floor. The mother can harm the baby. It is important you quickly take the baby from the mother and take care of the baby. Can give it to somebody you trust who can be in charge of the baby to ensure that the baby is safe. Secondly, is the fact that the family of the woman should be carried along, because they understand the woman better. They know the past history of the mother of this baby. The family of the woman should be informed, and they will be able to provide the past history of the woman so that they know what to do. Could it be that she has a file in one hospital? Could it be that she has a file in one clinic where she has been getting treatment? Instead of starting from the scratch, they can just continue from where she stopped in the past, in case she has past history of mental health challenge. Beside that, the husband of the woman should stand like a man, stand as a man, take the action, put the garment of action in place to seek treatment for the woman, because it is treatable, it is manageable. It is not a do or die affair. It is a condition that can be managed. Besides managing this situation with medication, which will help to calm the woman down, there is a need for a clinical psychologist to come on board to work with this woman to help her come out of the trauma associated with postpartum depression, help her to gain consciousness, help her to come to terms to reality and to change dysfunctional thought and illogical reasoning, and help this individual to regain her life back. It is important for us to understand that managing individuals with postpartum depression can be a bit challenging, but when well managed by a licensed clinical psychologist and also with a psychiatrist, it will go a long way helping this individual to regain her full functioning. So at the moment, it is important for me to let us know that, are you somebody listening to this content and you have found value in this our production? Kindly help us share, help us like, help us let other people know about this, because a stitch in time saves 9. Knowledge is power. It is also important for us to learn about preventive measure to ensure that postpartum depression is far away. We are living in an environment that is very toxic, very stressful. It is important to ensure that while women are in pregnancy, stressors are minimized such that it will help them to carry the baby without coming down with postpartum depression after delivery. I am happy to be with you today. Thank you for always helping us in our content, helping to support our program. We look forward to seeing you in the future as you join us to watch and to share, to like and subscribe. Thank you all for listening. And everyone who has listened to this content today, kindly ensure you learn from it and do something that can help another individual to learn from it. Thank you for listening. I see you in another production. Thank you, and thank you all.